Hey, what's up? I'm Dr. Nathu. This is Dr. Mahdi with me, and this is the Dental Tips Podcast. And every week we're going to go over one topic, one question, where Dr. Mahdi is going to pitch in with his take on things. And for this week, we're going to talk about. I had one question, was that class fives that are exposed, like root exposure underneath the crown, usually on molars, mandibular molars, maxillary molars. Is that necessary to prep? Like, is it necessary to prep those teeth, or is it something you can just etch, bond, and just slap composite on it? What are your thoughts
I
on it?
I found that if it's clean and you just etch that it's fine. Are you talking about as opposed to beveling?
Yeah, as opposed to beveling, or yeah, exactly. As opposed to beveling, or even prepping for retention.
I don't have any statistics on it, but just anecdotally from what I've experienced, just making sure that if they've come from a cleaning, that you clean their teeth, or before you start, you should use a Profi cup or use some sort of white stone. Or if you're going to bevel and you're using a diamond, you just make sure you clean the surface. I think beveling is definitely a plus, but I think with just etching the enamel for at least 30 seconds, that you should be fine, and you can bond composite to it. Um, I'm really careful to let people know that there's three options. They can monitor the area. If there's no cavity and they're not sensitive, then it's okay to monitor it, or they can go to a periodontist and have them do a gum surgery, such as a connective tissue graft. Um, and I'm careful to do it on anyone I suspect it would just come right off. Like if it's not deep enough,
Yeah,
not really close to the nerve, and it's not bothering them, and they grind their teeth a lot, it could come off sooner rather than later.
right.
Or if there's somebody that gets staining on their teeth, and you're really twisting their arm to do it, and it's not checking some of these boxes, then and you're not open and honest about the options, including doing nothing and just monitoring it, then you could have an angry patient if it comes off quickly. Did you have a case recently?
Yeah, I had a case. It was actually planned. It wasn't planned by me, and it was planned at the office for it was mesiofacial distal. But
Okay.
the reality of it was that the exposure went all the way to the lingual. So I kind of like just well, based on the coding, I just did the mesiofacial and distal.
So was it like a deep abfraction with a lot
Yeah,
of?
yeah, deep infraction. Well, a lot of root exposure, just a root exposure across those
Okay.
surfaces.
Did it go like inward towards
Yeah,
the?
yeah, it
Okay.
did. It was an infraction. Yeah.
Was there any
So
chief complaint, or was it something that you found or a previous doctor had treatment plan?
previous doctor treatment plan, and I asked them if they were symptomatic, and they said no.
Okay.
But I guess it was a preventative
Okay.
restoration. So I went ahead and did it, and then I
Mhm.
kind of I kind of blended it in
Mhm.
instead of going on the lingual. I just blended it in.
What
But I was like, it was confusing because it was the first time I had done this kind of restoration.
what
And
type, what tooth was it?
it was number 30.
Number 30, you had said, and it was basically facial.
Yeah, it was facial, but then yeah, facial, pretty much facial, but then it was yeah, also on the
Yeah.
distal by the contact, and then
Okay.
distal as well.
And are they missing any teeth? Like 31 is
Yeah,
missing.
31's gone.
Okay, so that's how you were saying you could wrap around.
Yes,
I was
exactly.
confused when you said wrap around.
Right, right. Yeah,
So
31's gone. So the distal, you could just keep going, and then hit
yeah,
the.
I mean, I see more cavities happening on the facial.
Okay,
I mean, on the tongue side, it's usually the tongue keeps it clean, so people usually don't get cavities. So I
right.
wouldn't feel badly about leaving lingual recession.
Okay,
Um, yeah, and that could feel, if any of the filling chips, maybe it feel rough on their tongue as
right.
well.
Okay, that makes
Um,
sense. Is this
but
is this something that is planned often, or is this something that's like not too common?
Insurances don't cover it a lot of times. I didn't know that early on, and then later on, I started to pay more attention and realized that they weren't covering it.
Okay.
If you take good intraoral pictures, it's good. I find myself taking pictures before and after almost everything I do now, just because it's good to show patients, and it's also good for insurance,
Right.
um, for buildups, for regular fillings. But yeah, I would say it depends. It's not something that's routine. Like it depends on how deep it is, if the patient's sensitive. If it's deep, then you want to fill it. It may improve their aesthetics, but if it's somebody who's really picky and they're not a high caries rate and it's not very deep, then you might want to lay off of it.
Okay.
Um, but if it's getting close to the nerve and you can get some retention because it's deep,
Yeah.
then you might want to do it.
Yeah.
And it's also important to overlap onto the enamel because remember you get a good strong bond from enamel with composite, not so much on dentin. So you want to bring it onto the enamel as much as possible.
Right. Okay. Okay.
Hmm.
And for photos, do you okay, so I have these mirrors that I bought like on Amazon.
Uh-huh.
They're kind of covered right now, so they look a little whatever,
Hmm.
but are these like you just buy these $5 mirrors and then you kind of put them in the mouth and then you use a cell phone or you have a digital camera?
I use the mouthwatch camera. It's an intraoral camera.
Okay.
It's really affordable and it comes out pretty clear. The image starts to fade after like 2 years. So you kind of have to buy new ones like every 2-3 years. But I
Okay.
think they're like around 350 for each camera.
Okay, cool. All right.
So
That's
yeah.
worth it in the
I mean,
long run.
obviously, an extraoral camera they probably get slightly better image with like a digital camera.
Mhm.
Um, yeah, and any mirrors that if you need, it's always good.
Yeah.
I like
All
the
right, cool.
intraoral camera though because it's just really quick.
Yeah, because you're literally right there and you don't need to worry about
Yeah,
anything.
you just hit the button, you grab it. Um, you don't have to worry about focus as much.
Right. Okay, cool.
Mhm.
All right, so maybe we can have a different like a different podcast on that on the cameras and like
Mhm.
taking the right pictures and stuff with that.
Cool.
But yeah, thanks for that. I guess we'll conclude it with that.
All right.